So welcome everybody. My name is Anne Siskos and I'm a program advisor at IHN. I do a few other things as well. I do have a background in education and administration, and I'm a recent graduate of IHN. So tonight's webinar is Gut Infections with Brett Hawes. And it's an excerpt from the upcoming continuing education course, the Digestive Health Practitioner Masterclass. It is a collaboration between Brett and IHN. It will be running online for 8 weeks, starting on Tuesday, October 24th. And you can register by going to the IHN website. Also, the whole format of the program is on there. Brett will be talking more to you about this. I personally have taken this course. It's so well organized, very extensive, in depth, and relevant and valuable for the practitioner as well as the individual. And anyone who has ever taken a course with Brett, you will know that he is a gifted practitioner and instructor. So for tonight, the format, it's an hour, give or take, webinar, followed by about a 15-minute Q&A. Brett has let us know that he'll take a few more questions after that. So we'll see how that works at the end. As you think of your questions, just pop them in the Q&A as we go along, and I'll filter through those at the end. So now, about our presenter, I'm very pleased to introduce to you the experienced and innovative practitioner, as I said, a gifted instructor and leader in our industry, Brett Hawes. He's a functional medicine practitioner as well as a CNP. He graduated from IHN in 2006, and he has been in practice ever since. He's going to do a little bit more preamble about what he is doing right now. So at this point, Brett, I'll throw it over to you.
Awesome. Thank you so much, Anne, for the intro. Great to be here, everyone. And I am always very enthusiastic about presentations. Tonight's presentation is gut infections in clinical practice. I've done this a few times before, and this will end up probably being about 90 minutes in total with questions. I'm going to just do a very lightning fast introduction of myself. As Anne said, my name is Brett Hawes. I am a certified functional medicine practitioner and holistic nutritionist. I'm also the host of the Beyond Health podcast. And I started practicing before I graduated, just helping people with basic stuff, weight loss, energy, blood sugar, that sort of thing, working out of my home. And then sort of as I graduated and ventured out into the field, started working in clinics, worked for myself. I rented space. I've pretty well done it all in the space. My expertise, and about 90%, I would say maybe even 95% of my practice, is really the intersection of gut health, hormones, and autoimmune disease. And that is, most of the people that I work with, that's them. Very chronic, very complex issues that take a bit of time to work through. I have also spent 16 years as a professional educator, both with IHN, but also with some of these companies here. So in a variety of different capacities, whether it's formulator, educator, consultant, and so on. You'll see at the bottom there, the NHPPA, which is really front and center right now. I work with them. They are really trying to safeguard our access to natural health products at the moment. Also worked with the Detox Project, and currently working with Children's Health Defence as well as their regional director for Ontario. So let's jump into it. Tonight, what we're going to be covering is exploring the microbiome, how poor digestion leads to gut infections. I want to spend a little bit of time talking about dysbiotic patterns of various gut infections, and you'll see why that's important when we get to it. But very, very important to just recognize patterns. We'll talk about functional lab testing and some of the challenges and limitations, especially because they've really become very, very trendy these days. And I find that people are sometimes really overdoing it on the testing, which is largely unnecessary. So we'll talk a little bit more about that. We are going to zoom in on comprehensive digestive stool testing. We'll talk a little bit about SIBO, and then we'll talk about organic acids testing. I will just share with you some insights on biofilms, so the 5 stages of development and how they might contribute to chronic infections, what to look out for, and then some nutraceuticals that can actually help with that. Novel approaches to using antimicrobials, prebiotics, and probiotics. So that for me is really, really important nowadays. And the last point as well ties in with that, which is a framework for working with gut infections. So I find that a lot of people, we talk about the microbiome as just this thing, right? And we simply refer to it as gut bacteria. And if we have an imbalance, the standard approach is really to blast it with antimicrobials or antibiotics and then to repopulate afterwards. And that is really standard practice, both in the functional medicine and in the holistic space as well. And so I'm going to sort of give you a bit more of a nuanced discussion tonight on some other ways to think about that and how to approach it, and what I actually do in my practice and have obviously coached other practitioners to do as well. So when we think of the microbiome, as I said, most people out there, if I stopped, anyone that heard that word, if I stopped them in the street, I would say 9 out of 10, maybe even 10 out of 10 people would simply say that the microbiome is the bacteria in your gut. Okay. Now, that's a very, very oversimplified view. What we should actually be referring to this as is the organisms that live in and on us. So we don't actually have one microbiome. We actually have many microbiomes. And if we look over here, we can see that we have an oral microbiome. We've got a vaginal microbiome. Interestingly, we actually have tests now where you can test the vaginal microbiome, which is quite interesting. Obviously, we've got the gut microbiome. We've got a skin microbiome, right, which is different. And then a placenta microbiome. So if you actually look at the legend here, and we don't need to, laser focus on this, but what you'll see is the composition of the different microbiomes looks different. Right. You will see that there are different types of bacteria that contribute to skin issues. You'll see that here, things like obesity, metabolic syndrome, diabetes, IBD, psychiatric disorders, all influenced and impacted by the gut microbiome. Okay. Now, just a couple of points here, and we might touch on this later on in our travels tonight. But what we're starting to see is that the oral microbiome, there's certain bacteria from there that can land up in the gut that shouldn't be there. Okay, and so that can give us some clues as to what's happening with digestion. We also see that through stool testing, we can actually identify certain types of bacteria that might be fueling and contributing to a lot of skin issues, whether it be acne, psoriasis, dermatitis, and so forth. So really working from the inside out is absolutely key. And it's something that I've really driven home for many, many years. And I find that, some people have taken my hormone masterclasses, some people have taken my autoimmune masterclasses, and what you'll notice is that everything starts from the gut and works out. And if you approach it that way, what you're going to find is it's much easier to address the hormone imbalances, the autoimmune disease that's happening sort of further down the line, so to speak. So just a couple of teaching points here. You'll see that the human microbiome, so this is the overall microbiome, is about 90% bacteria, weighs about 4 pounds. But you will see that there's also fungi, yeast, there's viruses, there's protozoa, there's all sorts of other things that make up that microbiome. You'll actually see that the number of bacteria, actually outnumber human cells by 10 to 1. So it's a vast body, or it's almost an organ in and of itself when you really start drilling into it. Now, for most of us, from a very superficial standpoint, we've all heard that there are good guys and bad guys. And if there's not enough good guys, or maybe there's too many bad guys, this is what sort of contributes to imbalances, and then by extension, some of the health issues that one might face. So this is a very, very oversimplified diagram and concept. And we have really grown to understand that this is far more complex than just looking at good guys and bad guys. And really what it is, it's about the relationship between these organisms and how they're sort of playing off one another. So if we look at the microbiome makeup here, what you're going to find is, and let's just sort of zoom in now on the gut microbiome itself, right? So we'll sort of park the skin and everything else for now. What you're going to find is 90% of the gut microbiome is made up of bacteria, and you have what are called normal or keystone or common cell bacteria. These are the organisms that are inhabitants of the gut. They live there, they're residents. And then we have a subset of bacteria known as opportunistic bacteria. And these really, they sort of like, if the opportunity arises for them to become overgrown or for them to take a foothold in the gut, that's when they will sort of seize the moment, and hence the name opportunistic bacteria. Okay. We also have fungi, yeast, viruses, and I put parasites in, there's a question mark next to that, much like H. pylori, which, has also garnered a lot of attention over the years. The questions are now starting to arise, like, are these organisms, are they actually symbiotic organisms that are supposed to be there if they're not causing any symptoms or illness? Or are they true parasitic organisms that shouldn't be there at all? And I think that's sort of an ongoing debate out there in the health space. So the highest variety of strains that we've identified in the gut is around 300. Yes, there have been some studies that have suggested up to 500 and even 1,000. And what I mean by that is, if we looked at the microbial makeup of the gut, how many different organisms or strains have we identified? And the number that we've settled on that we can be pretty sure of is actually 300. Most healthy adults have between 125 to 200. Simply put, the higher the variety, the more robust the microbiome. And so what we start to see is, in certain disease states, we'll actually see that those numbers, I think the lowest I've got has been about 50 organisms. So that means that that person is actually missing a large percentage of organisms that should be in the gut. So diversity is strength. And when we lose diversity, our microbiome and, of course, all associated functions actually become weak. So bacteria also differ from the small intestine to the colon, which is interesting. So there's a slightly different microbial makeup, which does tie into stool testing, which we'll talk about a little bit later. There's 4 main phyla in the human microbiome. Bacteroidetes and Firmicutes are by far the largest families or phyla, if you will. These are reflected on a lot of the stool tests. We do also have actinobacteria, which is quite high in childhood, and the levels sort of even out as we get older. We have proteobacteria, and then, of course, there's many other phyla as well. So the microbiome is relatively sterile at birth. And I say relatively, I think a lot of people still say it is sterile, like completely. We now know that that's not the case. It's definitely not as populated as, once you hit childhood or adulthood, for sure. The baby does receive mother's microbes as it enters the birth canal. Yes, there are microbes that do cross the placenta in utero, but this does bring into focus now what happens with C-sections, right? Especially, it's one thing to have an emergency C-section, or you have to have that, but there's a lot of women now that are opting for C-sections. I think the last time I looked, it was about 35%. So, 1 in 3 kids are being delivered C-section and not getting the microbes through the birth canal. So further received through breast milk, we know that development continues to be governed by diet and environment, but a lot of the research now is suggesting that the microbiome is relatively fixed after age 3, which is interesting because when you start talking about things like remodeling or strengthening or what have you, what you will find is this is something that has to be maintained on an ongoing basis. So, for example, and of course, on the flip side, if you take antibiotics, you are going to disrupt that microbial makeup. But taking more probiotics, taking more prebiotics, changing your diet, let's say you went from a straight carnivore diet to a fully vegan diet, it is going to change the microbiome based on what you're eating. But generally speaking, it's pretty fixed. All right. So I don't want you to think that if you went on a 12-week diet program that your microbiome is just going to change for the long run. All right. So This influences many, many body processes, and this research is just galloping along and expanding. We know, obviously, digestion. So the microbiome is involved with digestion of certain nutrients. We also know that it synthesizes nutrients, right? So a lot of the B vitamins, vitamin K2, short-chain fatty acids, of which there's a good 3 or 4 of them that are super important. These are all synthesized by the microbiome based on what your diet is. Gut barrier function. So this is where we start tapping into things like leaky gut, immunity, right? All of those are connected. Neurotransmitter synthesis and metabolism. So when we look at things like melatonin, when we look at serotonin, dopamine, there's the newer research is really showing that our gut synthesizes the majority of it. And when you start looking at things like the enteric nervous system, which is really a part of the gut, it's sort of the brain in the gut, what you'll find is that enteric nervous system, or ENS, is actually synthesizing the exact same neurotransmitters and hormones that you would find floating around in the body, the brain, the nervous system, and so forth, right? Hormone synthesis is super interesting. I mean, this is an area of focus for me, whether we're talking about actually synthesizing them or metabolizing them in the case of things like estrogen, right? Where we have an estrobiome that is heavily involved with ensuring that estrogen is detoxified through the gut. We know that the microbiome is involved with mood and brain function. There's actually a branch of study now, or certain types of bacteria that are known as psychobiotics, believe it or not, that have been proven to alter or improve mood and brain function. General metabolic function, blood sugar regulation, and there's a whole bunch more, including things like bone metabolism and so on. So moving us forward, let's talk about poor digestion, the microbiome, and infections. Because when people talk about, and I'm sort of using infections in quotation marks here, because it's really an imbalance is what it is, okay? So when we look at this, I think there's a couple of really key things to highlight here, is that your digestion, aside from digesting food, actually serves a number of other key functions, right? And so when we look at things like stomach acid, for example, right, first of all, everything starts at the top and works its way down, so from the mouth through the esophagus to the stomach, from the stomach to the small intestine, onto the colon, and then out. But it's one-way traffic. So everything has to happen here in a certain order. And it's taking things and breaking them down from longer to shorter to shorter to shortest. And if anything is compromised along the way, that's going to cause problems right the way down the digestive tract. So one simple example, if I don't chew my food properly, right, that puts pressure on the stomach, which then puts pressure on the pancreas and the gallbladder. It puts pressure on the small intestine, the large intestine, and so forth. All right. So when we look at the impacts here, low stomach acid, one of the things, when most people just say stomach acid is involved with protein digestion, true, but stomach acid is also involved with sterilizing of pathogens. And so oftentimes what we'll see is, as I said earlier, when bacteria that are in the oral microbiome that should not be in the gut, when these start showing up on stool tests, that's one indicator that the person might actually have low stomach acid, right? Because they're not being sterilized. We see the same here with things like H. pylori, for example, which is known to suppress stomach acid, but nonetheless, a very key first line of defense here. Low stomach acid, we know, it does not trigger the pancreas and the gallbladder. So that means we have low enzyme output, which means that food is not properly digested. And then by extension, opportunistic bacteria might finish that digestive process and cause, they might become overgrown, right, as they feed on that. We also have poor bile flow. This is really, really key. And I've seen a lot of practitioners kind of gloss over this. And as they've glossed over it, I've actually dug in more and more and more into bile flow, because a lot of people don't realize that bile is not just for fat digestion. It actually has antimicrobial properties. It also has alkaline properties as well. And it's also involved with motility. So there's a lot of things, very, very important things with bile. And I find myself often as frontline sort of treatment, so to speak, I will often use bile in supplement form. to get things, and of course, to get things moving, right? So changes in pH, obviously, we know that things are operating in a specific pH range, damage to the gut lining, right? So all of these things together can cause damage to the gut lining, which paves the way for leaky gut, autoimmune diseases, food allergies, systemic toxicity, inflammation, and so much more. We actually find that this is the root of many different types of health issues. And this is why working on the gut side of things first will give you, like I can just tell you right now, it will make your life so much easier by the time you get to the hormones, the inflammation, et cetera, et cetera. Okay. So let's talk about some dysbiotic patterns. And I want to just share briefly, like, why is it so important to look at this and to talk about patterns, right? When you get into the medical world, one of the things that makes a diagnostician good is the ability to detect patterns. So the more that you work with people, and I'm coming up on almost 20 years in practice. Next year will be 20 for me, give or take 19 and a half, 20, somewhere around there. But the more that you work with people and the more that you just keep seeing people over and over and over again, and you have the same questionnaires and the same intake forms, you start to see these patterns that happen over and over and over again. And what this is symptom recognition, right? And why this is important is for a number of reasons. First of all, I find that a lot of practitioners now, especially in the functional medicine space, they don't understand dysbiotic patterns. They don't understand symptom patterns. And what happens is they latch onto the lab tests without actually pairing the lab tests with the symptoms that their client or patient is experiencing. So the way that I worked, right, for many years, I worked with no lab tests whatsoever. So I had to work off symptomology. Symptomology was the thing that I had to work off. And so I got really, really good at looking at these patterns. And in the early days of doing functional lab testing, I would actually say, so this is what I think is going on. Let's run a test to rule it in or rule it out. And lo and behold, 90% of the time, the lab tests would actually confirm what we were talking about from a symptomology picture. So in short, what I'm saying is that recognizing and understanding what some of these patterns look like will help to guide your testing choice. Okay, so not everyone needs a SIBO test, not everyone needs an organic acids test, not everyone needs to do a stool test, and so on and so forth. Because, unless your clients have tons of money lying around and they can just test, most people are not like that, right? So you need to be discerning with your tests. Also, when you understand dysbiotic patterns, it can really help to guide the treatment approach as you start working with that person, right? And maybe in some instances, there's so much groundwork to do in the first 2 or 3 months that you don't even run a test until further down the line. Okay. So I think that's about it before we jump into this. And so some of the patterns that we're going to talk about tonight, we'll talk about IBS and SIBO. So let's have a look at that. This here, I mean, the amount of times that I've called IBS and called SIBO, and then we start looking deeper, and lo and behold, they have it, right? It happens so often. So first of all, your person with SIBO is going to react to high FODMAP foods. I'm not going to run through all of these. I mean, it's readily available online, but essentially, these are fermentable carbohydrates. So you can see they're fructose, lactose, fructans. So this is the big one, really: garlic, onion, inulin, and so forth. Galactans from legumes and beans, and then polyols from our sugar alcohols and certain types of fruits. So when you're working with people and you simply say, hey, what foods do you react to? And they start checking a lot of things off this box, I start to go, good chance you have SIBO, and good chance by extension then you probably have IBS, because the bulk, depending on which studies you're looking at, anywhere from 54% all the way up to 75 or even 80% of people with IBS have SIBO. Okay, so next, IBS following a bout of acute gastrointestinal infection. So this would be technically post-infectious IBS or post-infectious SIBO. A temporary improvement in IBS symptoms after taking antibiotics. All right, really, really key. So when you're speaking to people and they say, yeah, you know what, I've got these recurring infections, I've got these flare-ups that keep happening and then they die down, And every time I go to the doctor and I get on antibiotics, my symptoms improve, but then they come back. That's a really good indicator that someone's got a chronic infection of some kind. And if they're checking all of these boxes here on the slide, I would definitely be looking into SIBO. A worsening of IBS symptoms from ingesting probiotic supplements, especially those with FOS. All right. So how many people out there are taking probiotics? They're taking prebiotics. They're taking fiber, right? So that's next on the list. So they're taking fiber and they're doing all the right things, quote unquote, and their symptoms are just not either getting worse or they're just not getting better at all. Okay. So these are some of the things to look for in terms of pattern recognition with SIBO. And then if we move on, let's have a look at some of these. I'm going to lump some of these together here, but let's take a look at Candida, yeast, and mold. So these are some of the common symptoms that you would find with Candida, yeast, fungal infections, and so forth. Fatigue, chronic fatigue syndrome, depression and mood swings, big time. Chronic dermatological or skin infections. So rashes, acne, eczema, these types of things. Abdominal bloating and gas, indigestion, leaky gut, not always, right? Constipation or diarrhea, so there might be some overlap there with IBS, and recurring vaginal and or bladder infections. So more on Candida here, immune system dysfunction, chemical and food sensitivities, right? So just want to pause there for a minute. With Candida particularly, the things that I see coming up over and over and over again with regards to food sensitivities are things like sensitivity to red wine, sensitivity to cheese, artificial sweeteners, and sulfites. Okay, so found in things like dried fruits, if they're eating foods from the salad bar and so forth. There's a reason why those foods are there. I won't get into it now just for the interest of time. But nonetheless, those are the types of foods that I keep. And of course, sugar, baked goods, and that sort of stuff. Okay. From an environmental sensitivity standpoint, oftentimes we'll find people that have chronic candida or fungal overgrowth will also be very, very sensitive to mold in the environment. Okay. Almost every single time you will see hypoglycemia or some type of blood sugar imbalance go hand in hand with candida. This will actually spill over very often into adrenal issues as well, okay, because they're trying to compensate. Food cravings for carbohydrates, sweets, sugars, that sort of thing. Poor concentration, memory problems, and foggy thinking. This actually is right near the top of the list when it comes to symptoms, believe it or not, is foggy thinking and brain fog. I find that out of all the things that improve the quickest on candida cleansing, this is one of the first, right? People start to go, oh my gosh, the fog is starting to lift. And then a little bit lower down there, but you'll see that tinnitus is on our list as well. So for parasites, a little bit harder to sort of zoom in on because the symptoms are all over the place. Okay, so chronic diarrhea is often a very big clue, probably one of the biggest ones. Constipation, skin bumps, or rashes. Another big one here in bold. Unexplained weight loss, increased appetite, or both. Okay, so this is a person who's eating, they just can't get enough food in and they're dropping weight. They've got chronic diarrhea that it doesn't matter what they do. A lot of people will have tried elimination diets. They've done food sensitivity testing. We'll talk about that in a minute, and still nothing. All right, so nothing has moved there. Abdominal pain and cramping unrelated to food eaten. So what that means is, and this is a really, really important distinction point here, is this is a person who's going to have very erratic symptoms. So they're going to say, you know, oh, empty stomach, full stomach, after certain foods, it doesn't matter, right? These sharp shooting pains in the abdomen just pop up out of nowhere, okay? Might actually be getting worse coming into the full moon as well. So vomiting, joint and muscle aches and pains, 100%, sleeping problems, anemia, and then general aches and pains. So just a quick note on food sensitivities and allergies here. Because it starts getting tricky, right? So let's say you've got someone with SIBO. Let's just go back to that. And that person is reacting to FODMAPs. And now I go and do a food sensitivity test. Here's what's going to happen. The food sensitivity test is not going to show a reaction to that, to the FODMAPs. Why? because there's a difference between an immunological response with your immune system, where you're actually producing antibodies like IgG, IgE for immediate reactions and so forth, versus microbial fermentation of something. Okay. Or if you have an intolerance, the ability to actually digest food, which is going to cause a lot of abdominal discomfort, et cetera, et cetera. So there is a difference there. And the reason why it's important to understand this is a lot of times you will send people out for food sensitivity testing, and you're going to miss a whole bunch of stuff. Okay. I find myself nowadays, I do less and less food sensitivity testing. I really do it if I have to. Maybe down the line, if we run into a bit of a wall, I'll do it. But generally, I find that if you point your efforts more towards the SIBO or the Candida or whatever it is you're dealing with, that's going to really move the needle forward much better than trying to just eliminate food sensitivities. All right, so let's jump into functional lab tests here. Just a couple of general points for consideration here. Functional lab tests are not diagnostic tests. I have to stress this because a lot of nutritionists, especially, are very panicked around this whole idea of testing. And so they go, oh my gosh, is it out of scope? We're not allowed to diagnose disease. Am I allowed to run functional lab tests? Okay, so I want to explain what functional lab tests do and what they are. First of all, when you run a functional lab test, the goal is to assess metabolic function. That's what you're doing. Okay, this is, take some notes because this is really good stuff to share with your clients. Where I explain to them, I'm like, listen, I'm not here to diagnose disease. I'm not running tests to diagnose disease. I'm here to assess metabolic function. I want to understand why you have what you have. And then the goal is to restore function using natural therapies, food, supplements, et cetera, et cetera. Okay, so it's a really, really key point here, and it should give you a little bit of comfort, knowing that we're not trying to diagnose disease. There's no risk or getting into hot water with any of this. These are, you're trying to figure out why they have what they have. So why test, and what are you testing for? Right, so this is also important. Why, if you can't justify a test, and there's this term called medically necessary. And I don't like to use the word medical, but I always ask myself, why am I running this test? What am I hoping to find here? Is this test necessary? Right? Because if we're going on a fishing expedition and we're just wasting our clients' money just to have a look-see, that for me is not ethical in terms of the way I practice. And I can tell you, I've seen clients like $5,000, $10,000, $15,000 in lab tests when they come and see me. And I look at it and I'd say 3/4 of them, I'm like, irrelevant, right? Didn't give you any good data to work off. So what are you testing for? Remember that a functional lab test is only as good as the thing that you're looking for, right? So if you're running the wrong test and you're trying to glean some other kind of information, there's a mismatch there, right? So you want to run the right test at the right time for what you're looking for. So run tests that are necessary, run tests that will give you actionable data to work off, right? So really, really key. Okay, it's all good. We live in the information age now, and I am part of many different groups, and I can tell you they get so granular with some of the stuff. I'm like nice to know, good info, but what are you actually going to do with that? How are you going to work with this in a clinical setting, right? So using tests that are necessary, that give you actionable data to work off, means that you can actually help your clients move through and into better health. And remember that a test is only as good as the person interpreting them, right? So you have to start somewhere, but interpretation of testing together with symptoms is really, really key. And that's why I say master symptomology, master those dysbiotic patterns, and then get really good at interpreting the tests, right? That's where the magic really happens. So some advantages and limitations. You must run the right test depending on what you're looking for. Key point, no test is 100% accurate. Okay, it just doesn't exist. You're always going to miss something. Broad spectrum biomarkers, in my opinion, are far better than narrow testing. So I hear this all the time from people where they say, oh, I went to my gastroenterologist or my GP and they ran a stool test. And I say, awesome. What did they run? And they give me the results and it's one organism, right? So they suspected that maybe I had C. diff, or maybe they suspected a parasite, which is usually the case. And so they run a parasite test, one stool sample collection, and then boom, that's it. And they go, oh no, you're fine. I would much rather run stool testing that is very broad, that can look at a number of different biomarkers, which we'll get into in a minute, and assess overall function, right? So I would like to get a gauge on overall gut health versus isolated infections, okay? To me, that's a much more holistic approach to things. And I can tell you, once you have that broader view together with the symptoms, you are in a much better position to truly help your clients. There are limitations for the small intestine. So a stool test does not test what's in the small intestine, okay? And so, yeah, small intestine versus colon testing. Obviously, we just spoke about that. It's very difficult to test the small intestine, just as an FYI, okay? So we'll talk about that in just a minute. So functional lab tests for GI infections. This is what I find myself gravitating towards. Yes, there might be a couple of others here, but I find myself using GI map and Biofilms probably the most, I would say. I do sometimes use GI effects from Genova Diagnostics. I don't really use the CDSA from Great Plains Laboratory. However, I share that with you because it is a useful test for certain things, right? So we'll take a look at some sample reports here in just a second, where you can have a look and see what it looks like. Organic acids testing, I find myself these days mostly using OMX from Diagnostic Solutions. I used to use, and I still do, from time to time, I do use the organic acids test from Great Plains. They're now known as Mosaic. They recently changed. That is their flagship test. So that's actually what they're known for, is their oat testing. Okay, OMX is a little bit more of a new kid on the block, but I like it because it's a really, really good metabolic test. And it extends way beyond just looking at GI infections. So I'll just say this much, that in the functional medicine space, what a lot of providers are doing is they're running these two tests as broad spectrum screening tests right out the gate, okay? Because you can actually assess a lot. I mean, I think the organic acids test has about 78 or 80 biomarkers, and the stool testings is about the same, right? So you've got a lot of good data to work with there. Again, a lot of providers are using that as an initial screening tool. SIBO tests here, SIBO Clinic Canada, Genova Diagnostics, which we can now access again through our lab brokers that we work with. And then a novel device called Food Marble. We've actually had some good training with them, which is in the Digestive Health Practitioner Masterclass. A really, really cool device that I think is going to become more front and center as time goes by because of the cost. Okay, so more on that in just a minute. So let's look at some of the data points here. And, just keep in the back of your mind, looking at something that's very narrow versus looking at something that's very broad, right? So if we look at what is possible on a CDSA, this is what's possible to assess. So bacterial, yeast, fungal, and viral markers, parasites, worms, and amoeba, digestion and absorption markers, which is super useful, inflammation, immunology, intestinal health, leaky gut, sensitivity to antimicrobials, and ABX is antibiotics. By the way, it's just shorthand. And then drug and antibiotic resistance, which is very useful for us, but also for physicians, to know that, hey, if you've got something that's really, really stubborn and you're trying to work with antibiotics, well, it's useful to know which ones they're resistant to, okay? Because that's becoming a real problem in the clinical world nowadays. So this is what a CDSA looks like from Great Plains, okay? Doctors' data looks very similar to this as well. I find a lot of the naturopaths are running doctors' data tests. Basically, what this looks like, just to give you a sense of the legend here, you will see expected beneficial flora here on the top left. Anytime you have 1+ is the sort of low number, and then 3, 4+ is really good, okay, especially for the good guys. NG is no growth, and then you'll see here our commensal or imbalanced flora. If you go, the higher you go here, the more imbalanced it is. And then you'll see your dysbiotic flora here. So in this case, Klebsiella at a 4+. So this person definitely they got no growth on the lactobacillus, which means that one of their key sort of cornerstone bacteria is very, very low. And they've got very high amounts of Klebsiella, which is often involved with autoimmune and inflammatory type of responses. Okay. So this here, you will see Candida albicans. Some of the other tests, by the way, the GI map, which we'll look at in just a second, they actually test for more than just Candida albicans. They look at a handful of different yeast and fungi. And here you'll see on the CDSA from Mosaic, you will see that you can also look at microscopic yeast, which is useful. Okay, so even though it might not show up over here, you might find trace amounts, which means that they might actually have SIFO, which is small intestinal fungal overgrowth, and some of that's actually showing up in the stool. So this is from Genova Diagnostics. Again, I'm just sort of giving you a tour. If you've never looked at a sample report or you've never looked at these before, I'm more just trying to showcase what you would be looking at. And here you can see protozoa, nematodes. In this case, Endolimax nana is what has cropped up here. You can see here some other markers. So here we have red blood cells are showing up, white blood cells, so immunity. We've got yeast and a bunch of other things. I share this with you because this is very, very powerful when you look at it through this lens. And I want to highlight this idea of going to a physician and having a test for one organism. Can you imagine, just go back here. Can you imagine if you just looked at blastocystis here, which is a very, very common parasite, and that's all you tested for? And meanwhile, the person does legitimately have a parasitic infection, but it's something else down here. And now what are they told? They're told, oh, well, it can't be a parasite, must be something else. And now the person their patient is going off on a wild goose chase and thinking that there's just no solution to their problems, right? Okay, so this is very, very powerful to have these tests and this information on hand. Here you will see, again, this is coming back to the Mosaic test. This, unfortunately, the Mosaic test and I believe the GI effects are the only two that I know of that do test for sensitivity to antimicrobials. And so in this case, you'll see this is the Klebsiella pneumonia. And what do you know? How many people get married to single remedies? So they'll go, oh my gosh, I found my favorite oregano oil, and everyone with dysbiosis or anyone with an infection, this is what they're going to use. And you could see in this particular instance, berberine, black walnut, oregano, uva ursi, they just will not do anything, right? And in this particular instance, grapefruit seed extract is the thing that is going to work the best. Okay, so just as a clinical tip, this is oftentimes why I don't use isolated herbs or antimicrobials. I usually use a whole bunch of them together. Okay, so broad spectrum for that reason. Sorry, you'll also see here, just to back up a sec, this is what the prescription antibiotics would look like. So in this particular instance, that particular bacteria is resistant to ampicillin over here. So this is a GI map. So you can see here, we've got opportunistic bacteria, potential autoimmune triggers, which I find useful. I'm spending a lot of time there. As I was saying earlier, you can see here's 5 different types of yeast and fungi. So not just looking at Candida albicans, right? We can actually look at some others as well. You'll see Epstein-Barr virus and cytomegalovirus. Epstein-Barr EBV, really, really important for people suffering from autoimmune thyroiditis or Hashimoto's. Okay, so we'll see that crop up a fair bit. So more protozoa, worms, etc., etc. And then this here is the Biome effects test. It's a newer test, and it's a little bit different because it is a functional microbiome analysis. So when you look at things like the GI effects, the GI map, and so forth, they really focus and put a lot of emphasis on the infection side of things, right? And what Biome effects does is, yes, it looks at pathogens. So you can see here the pathogens, but they actually look at your alpha diversity. They look at your beta diversity. They look at your keystone species, and then they actually look at your functions, which I find really neat. So you can see from this stool test, is someone having a hard time with digestion of carbohydrates or proteins, or Are they having trouble producing and synthesizing short-chain fatty acids, or in this case, neurotransmitters? And so it actually goes all the way down into nutrient synthesis. It goes into the estrobolome. You can look at histamine. There's a lot of different biomarkers on there. It is a very, very robust test. And what I like about them is that they give you an overall microbiome index score. So the closer to 40 you are, it means that you have a robust microbiome that is resistant. And of course, the lower down you go, it's not good. So generally what we want to see, I've never seen anyone at 40. Generally what you want to see is 30 and above, case considered good. All right. So this is what it looks like. I don't need to spend a huge amount of time here, but you can see this is the healthy US population. And this particular person here is hovering right down the bottom. And so this is how I can see that their alpha diversity index here, which should be a 10, this person's alpha diversity is really, really poor, which means that the general sort of robustness and diversity of their microbiome is very, very low. And you can see that reflected over here. Okay. So again, just to show you, the biome effects gets very, very granular. You can see these phyla here. And just take a look at this on the top right of your screen, where all of these families should really be in the green. Look at the relationships between these. Right? So here you've got your Bacteroidetes that are super, super low, and then you've got your Firmicutes that are super, super high, right? Actinobacteria high, Proteobacteria low. So this here is really, really insightful with regards to the overall microbiome function, as opposed to just looking at the infection side of things. Okay. So moving us forward, let's just take a quick look at SIBO breath testing. Why do we use breath testing? Well, we use breath testing because it's really, really difficult to get accurate samples from the small intestine, right? Because if you do an endoscope from the top, you're only going to get to the first third of the small intestine or the duodenum. And if you do a colonoscopy, you're not going to get into the small intestine at all. So short of actually cutting someone open and doing a sample, it's nearly impossible to get an accurate gauge of what's going on in the small intestine. So the way that this works is we typically would use a lactulose or glucose. So those are typically the substrates. We use glucose or lactulose. And if SIBO is present, what you will find is that glucose or that lactulose is going to be fermented. In the process of fermentation, the bacteria will produce hydrogen and or methane. And then those are, you breathe those out. And so what you do is you breathe it into a bag over a period of time, so usually 120 to 180 minutes, and it will actually plot the hydrogen and the methane levels, and then you can kind of see what's going on. All right, so that's sort of 101 in terms of SIBO breath testing. The food marble test actually does this, but it's a device that you can repeat test over and over and over again, which is kind of cool. So breath testing measures both the hydrogen and the methane gas produced by organisms in the small intestine that is diffused into the blood, then the lungs for expiration. So we don't actually produce hydrogen and methane gas ourselves. That's why these are good gases to measure. Hydrogen and methane are graphed over 2 or 3 hours and compared to a baseline, and clients or patients drink a sugar solution of glucose and or usually or lactulose after a 1 to 2 day prep diet. That prep diet actually looks a lot like a low FODMAP diet, just by the way. Okay. So positive for SIBO. Again, I don't want to spend too much time in the numbers here. It gets quite granular, but nonetheless, I always tell people, when you're looking at this, you have to look at the numbers and not just the graph. Okay. So I don't want to spend too much time there. Just because it's much easier to show you this. So what you'll see here is if you look at the plotting here, our methane is the black diamond and the hydrogen is the blue and white circle. And what you'll see here is, sample 1, 2, 3, 4, 5, 6. This, I believe, is 120 minutes test. So that actually will only look at the small intestine, which can be useful. So what you'll see down here, if you look at the graph, because of the axis on the left, it looks like there's not a whole lot going on, right? It's sort of like, oh, well, this person doesn't have a ton of gas. But if you actually look at the legend at the bottom, anything over 20 parts per million is a positive. All right. Now for methane, this is where symptomology really comes in, because with methane, you can have symptoms being provoked even as low as 2 parts per million. Okay, so that's why I say symptomology is absolutely key. All right. So this is another test. This is 180 minutes, right? So a little bit different. And remember, the small intestine here is 120 minutes and before. Okay, so anything after 120 is considered large intestine. In this particular instance here, you can see that the person is positive for both hydrogen and methane. On the Biome effects test, we can actually see hydrogen sulfide and methane production in the stool sample. It's not always the best to sort of quote unquote diagnose SIBO from a stool sample. However, if they're checking a lot of those boxes that we discussed earlier, and these are coming up high, that's usually a pretty good indicator that you should stick them on some type of SIBO plan. If we look at the GI map, again, this is, definitely do not use this to assess SIBO. I've just seen these patterns over long periods of time. And so oftentimes what I'll find is when the phyla here are high, sometimes I'll see both the Bacteroidetes and the Firmicutes high, and then they're showing the signs of SIBO. I go, I think that you've got SIBO going on. And then maybe we would do a SIBO test. Here we can actually see that there is this bacteria here, which is known as methanobacteria. The name kind of says it all, methane. This is just, again, just a bit of a clinical pearl if you're familiar with running GI map tests. That's a new marker that they added on there. And there's actually another one which they've added on more recently called Roseburia, which can also kind of give you some clue as to SIBO. Right, so organic acids testing, very popular, very cost-effective. First of all, what is an organic acid? Anytime I want to convert something from A to D, I need enzymes to take me from A to B to C to D. And what happens is if there is a blockage in the conversion, now you can see on the screen it says blockage caused by vitamin insufficiency, but here's what we know. The blockage can also be caused by infections, whether it's candida, whether it's clostridia infections, very, very common. And so what happens now is instead of the substrate moving from A to B to C to D, we have a buildup of A. And that buildup comes out in the urine. So that's what we're measuring when we're measuring organic acids. It measures byproducts of microbial metabolism that are excreted in the urine. Really, really key point here. This can provide insight into the small intestine where stool tests cannot. So oftentimes what I find, because I've run these together, is I'll find that sometimes, for example, candida will not show up on the stool test. The person's got all the signs and symptoms, but if I run an organic acids test, lo and behold, that's where it shows up. And so that person is going to be dealing with small intestinal fungal overgrowth. Okay, so really, really key, because a lot of these things can go, they go undetected, right? And they can really throw a wrench in the whole treatment plan. Can also provide key information on mitochondrial function, Krebs cycle, neurotransmitters, nutritional assessment of vitamins and minerals, and obviously, as we've discussed, GI function and dysbiosis. So this is what it looks like. These are all the yeast and fungal markers. So again, this is the mosaic test. This is really what they're known for. And then you'll actually see as well that they also look for bacterial markers. All right, if we look a little bit lower down here, you'll see these other bacterial markers. So they can also detect general dysbiosis as well. Okay, again, where a stool test might not show up as clearly. All right, so just more of the same. Clostridia is huge. Most people, when they think of Clostridia, they just think of C. diff. But what we actually find is that there are many different types of Clostridia infections, so to speak, and they can really block a lot of the neurotransmitter synthesis. Okay, So again, can give you some good clues there. All right, so quick note here on biofilms. Now, biofilms, a lot of hoopla these days about biofilms and how cool they are and all of this good stuff. And the truth of the matter is that it's very, very difficult, dare I say, almost impossible to test for biofilms, right? But what are biofilms? If you've never heard of that word before, these are communities of microbial cells surrounded by a secreted polymer, okay? So what that is simply saying that you can see bullet point 2 composed of single or multiple organisms, including both aerobic and anaerobic bacteria and or fungal species. So we don't find viruses as far as I know. This is really bacteria, fungi, and to the best of my knowledge, I'm not sure if parasites are in there either. But essentially what this is you have these infections or organisms, and what they do is they build themselves a little shell, okay, and they all go and hide out in the shell. So biofilms have been well established in the medical field, particularly attaching and growing on things like catheters. If there's pins or if there's any kind of implants in the body, we find that biofilms grow on there. And because of this EPS, or this extracellular polymeric substance, which is like crab shell, what happens is it makes it very, very difficult for the immune system to attack. And it also makes it very, very difficult for antibiotics to get in there, okay? So what you'll find, bullet point number 3 here, is that organisms communicate via something called quorum sensing. So this is where they can communicate at distance. And more than 80% of all microbial infections have developed biofilms beginning in as little as 2 weeks from the onset of infection. So even though we can't test for them, especially if you're dealing with someone with chronic infections, you can be absolutely certain that there's biofilms going on to some degree or another. So biofilm bacteria can actually resist up to 5,000 times the antibiotic concentration that would normally be needed to resolve infections. Biofilms in the GI tract often contain something called LPS, or lipopolysaccharide. LPS, by the way, is one of, if not the most inflammatory compound known to human beings. And normally, because they just sort of exist on the outside of these bacteria, the more bacteria we have, the more overgrowth we have, the more LPS we have, and then by extension, the more inflammation we have. And if they become systemic, you can see it's underlined there, intestinal permeability can translocate the LPS to all parts of the body. So I see this happening a lot with autoimmune issues. Okay, and you can see there, biofilms are associated with many chronic diseases that affect numerous organs and tissues of the body: lungs, ears, oral cavity, GI tracts, joints is a huge one, and more. Right? And as I said, difficult to test and diagnose. So this is what they look like. This is really the formation. You've got the initial attachment. Then number 2, you've got this irreversible attachment. 3 and 4 into the maturation phase, and then 5 into the dispersion phase. Now, I just want to mention here, right? When do we suspect biofilms? So if we can't really test for them, what are we looking for? If you have chronic persistent infections and or health conditions, there's a very high likelihood that you're dealing with biofilms, particularly if it's tonsillitis, if it's otitis media, so recurrent ear infections, sinusitis, which by the way is usually related to fungus, chronic dysbiosis, chronic cystitis, and periodontal disease. Okay, key point here, key 2 points: cycling between flare-ups and asymptomatic periods. So what I hear from a lot of people with autoimmune issues particularly is they'll say, oh my gosh, I was doing so good. I was taking antimicrobial herbs. My symptoms went down, or I was taking antibiotics. My symptoms went down. And then as soon as I stopped taking them, everything started to flare back up. So I got back on them. And the trap here is that a lot of your clients, or a lot of people, will get stuck on herbal antimicrobials for a long period of time. Because what's happening here is the herbs that they're taking, or most instances, the antibiotics, are not penetrating the biofilm. And so what's happening is you're killing everything that's in the bloodstream or elsewhere, but everything that's trapped in that crab shell is just not being addressed. And so what happens is they hide out. And once the antimicrobials or antibiotics are gone, they come out and they start growing again. Okay, so I see this as a very, very common pattern. You'll actually see here bacteria that are involved with biofilms. So this is very, very useful when you're running stool tests. Okay, because all of these, E. coli, Staphylococcus, Pseudomonas, Streptococcus, and Klebsiella, pretty well all of them are on most, dare I say, all the stool tests that are out there. Okay, you can see some of the things in brackets there: UTIs, skin, psoriasis, dental plaque, UTIs. RA, by the way, is rheumatoid arthritis. Okay, Klebsiella, very, very strongly implicated in rheumatoid arthritis. Okay, lots of literature on that. So many of these are included in stool test biomarkers, as I said, specific to the GI side of things. The immune system here. So if these biofilms are affecting certain parts here, you'll see the immune system involved with autoimmunity, a weakened immune response, and inflammation. If they're more predominant and affecting the central nervous system, you might experience mental health issues, right? Anxiety, depression, et cetera, et cetera. The endocrine system, thyroid dysfunction, big time. And HPA, so hypothalamus, pituitary, adrenal axis. In fact, infections together with blood sugar are two of the biggest triggers for adrenal issues. Okay, food allergies would be a close third. So blood sugar issues, joints and muscles, and specific to the GI tract, periodontal disease, H. pylori, SIBO, celiac, and dysbiosis. Right. So I know that that's a mouthful. Don't worry if you didn't get it all. You can come back and pause the video and look at this. I just more want to highlight the fact that when we look at dysbiosis and we look at infections, we really need to start expanding our view into what's called more of a polyfocal type of view, right? So again, relationships, different infections affecting different parts of the body, and so on and so forth. So redefining our understanding of the microbiome and infections. So looking at the bigger picture, dysbiosis is a symptom of other underlying problems. Okay, really key point. Just blasting someone with antimicrobials or herbs or antibiotics or whatever, that's not really addressing the root cause at all. So looking at poor digestion, which we spoke about earlier, looking at poor diet, right? Whatever that is. Maybe it's low fiber, maybe it's too much sugar, maybe they're getting low dose antibiotics in their food, maybe it's glyphosate, pesticides. If they have a favorable environment for dysbiosis, okay, that can also be a problem. We'll talk more about that in just a minute. Oh, I see this all the time, right? Problems with long-term restrictive diets. So here's what happens. People do some reading, they listen to a podcast, read a blog, whatever, and they go, oh my gosh, I think I have SIBO, and I think I have IBS, therefore I'm going to go on a low FODMAP diet. What happens? When you go on a low FODMAP diet, the symptoms are going to go down, but here's the thing. A lot of the low FODMAP foods are very, very beneficial for the microbiome. And so what happens is if you go on these types of restrictive diets for long periods of time, right? What starts to happen is you starve out the good guys. So you actually starve out the beneficial organisms, right? This is also the case, not always, but often the case on a low or a no carb type of diet. Candida diets are notorious for this, where people get stuck on these types of plans. Because here's what happens. If your symptoms go down and now you're starving out the beneficial organisms, well, what happens when you open your diet back up? Right? The root causes are still there. So this is really, really key when we start to look at dysbiotic patterns through a different type of lens. And I would encourage you to just really write this down and start thinking about it like this. When we talk about dysbiosis, the standard definition is I've got too many bad guys and I've got normal or low levels of good guys, and that's it, right? Bernard Jensen was teaching this 100 years ago, maybe not quite 100, but close to it, simply saying, quote unquote, in everyone that's sick, you will see that you should have 85% good guys, 15% bad guys. And in all the people that he saw that were sick, that was reversed. Now, he didn't have stool testing. He didn't actually know that for a fact. And so what we now understand is that it's actually relationships between the keystones and between the pathogens. So the classic picture that we would talk about is the one that you're seeing in your screen now, which is low keystone species, so low good guys, and high pathogens. But we could also have low keystone species and no pathogens, right? I see this come up a lot. So the symptomology might look very, very similar, but can you imagine if you had low keystone species and you had no pathogens and you went and blasted that person with antimicrobials and antibiotics? This is the trap that people fall into. They are going to keep squashing their good guys down, and you're never going to get out of that. High keystone species and high pathogens, right? These are great candidates for antimicrobials, right? Because you've just got bacterial overgrowth all over the shop. So if we start looking at things differently and we start, talking about reinventing antimicrobial therapy, some of the things that we should be focused on is really preserving the keystone species. Okay, this is really critical. Using antimicrobials as little as possible and only when needed, repopulate as quickly as possible. So this is something where I've gotten really, really good at this, is moving people through the phases a lot quicker. And it requires some, finesse, if you will, because you can't do it with everyone, right? It's important to know where people are at and how to move them through those phases. But I like to get to the repopulation side of things as quickly as possible. You can use spore-based strains to crowd out the pathogens. Okay, so they work really, really well. You don't have to actually use antimicrobials. You can simply use spore-based strains. They're rapidly colonizing. You can also use a rotation of strains to achieve the same kind of result. You can use something called immunoglobulins and binders to actually mop up the microbial die-off, and using things like liver, gallbladder support to minimize Herxheimer or detox reactions. All right, so this is really, really key. It's a different way of doing things. In terms of disrupting biofilms, there's a lot of botanicals. I'll share a list with you in a minute that inhibit quorum sensing. They inhibit the initial attachment phase of biofilm colonies. They inhibit swarming motility and broad spectrum antimicrobials, right? I would stress this over and over again. Use broad spectrum. Okay, I don't like using laser focused. Sometimes berberine, sometimes oregano, they tend to be broad in their action, but I like to use different things together. I find they work much better. Flossing and oil pulling can help to disrupt oral biofilms and prevent translocation to the gut, right? So actually going down, lower down. These are just some of the things here that can actually help to disrupt biofilms. So garlic, oregano, bilberry, bladderwrack, golden seal. Curcumin and quercetin both reduce metabolic activity. Oregano, tea tree, galbanum, lavender, cassia, and thyme. So you can see there's no shortage of things here that will work on biofilms, right? Now, I just want to back up a step here because you'll see on the last slide that I put liver gallbladder support, that I put like binders, immunoglobulins, and so forth. Why did I put that there? Because a lot of people are very, very gung-ho to bust open biofilms, right? And here's what happens. If you break them open too fast and you go hard on the antimicrobials, that person's going to have a lot of die-off, right? They're going to feel really, really sick. I know someone right now that's been out, not a client of mine, but I know someone who's been out for about 8 days dealing with die-off, okay, from a candida cleanse. So these are some nutraceuticals. I'm not going to read through all of them again, just in the interest of time, because I do want to honor your time. But my point is there's no shortage of things here that can break down biofilms, okay? And this is fairly well established in the literature. Proteolytic enzymes to help break down that outer coating, immune supporting compounds to enhance biofilm treatment, right? Medicinal mushrooms, echinacea, immunoglobulins, colostrum, and some homeopathics. So the general framework here for general dysbiosis, so we can observe something called the 5R approach. Many of you might be familiar with this. That is remove, replace, repopulate, repair, and rebalance. I bend the rules a little bit here depending on the person. Okay, antimicrobial therapy followed by repopulation is pretty standard. However, you could do antimicrobial therapy together with repopulation. And for mild dysbiosis, you can actually avoid antimicrobials altogether and crowd out with probiotics, prebiotics, diet, and lifestyle. And the number one thing here is don't try and fix everything at once. Okay, that is my number one takeaway. Do not try and fix it all at once. Work in a phased system. And that is exactly what I teach in the Digestive Health Practitioner Masterclass. I know Anne sort of gave a bit of an intro here to this. So I will just put this up there and just share with you very quickly what's in here. You can visit the IHN website and just go and look under continuing education courses. You will see it's there. It's open for registration right now. We start on the 24th. This is coming into, I think, our fourth year now, And we've had over 300 practitioners go through this with some pretty glowing reviews. There's a lot of other stuff that I've added into the program. So therapeutic dosage guide, therapeutic diets and food lists. You'll see practitioner's guide to balancing blood sugar, which is absolutely critical. And then the book that I wrote for this, which took me a long time to write, is Digestive Health, the Practitioner's Guide. And that is actually a hard copy book that has protocols. I mean, there's so much in there. It's very granular. It's not a Saturday beach book, but nonetheless, it's got a ton of stuff in there, even from the medical side of things as well. So this is a little bit of what it looks like in terms of the overall sketch. Roughly 25 plus hours of pre-recorded content that we release each week. And then we follow up with that with a Q&A coaching session to sort of review what we've learned the week before. You have lifetime access to all the content. You'll see there's protocols and guidelines in there. As Anne said, it is exhaustive. This is not something I just put together. It's in constant development, and I've built this out over many years. So it is robust, and a lot of the practitioners that have come through this have actually gone on to build fully fledged clinical practices and businesses as gut health experts in their field. Okay, so yeah, I won't spend too much more time on this just because it's all there on the IHN website, plus the full curriculum. You can see exactly what's on offer. And what I would like to do is just get to some of the questions because I know that there's some questions in the Q&A.
Fantastic, Brett. Oh, so much in-depth review. The research has really jumped along in this whole area, and as holistic nutritionists, we're right to be trained in this area. So yes, questions and answers, everyone. If you're not familiar with the toolbar at the bottom, please put your questions in the Q&A box. I'll check the chat if there's any that pop in there.
Sure.
So let's get started here. All right, Mylan would like to know what high NAC marker on an oat test. What can that mean?
So an NAC, so that's N-acetylcysteine. So an NAC marker can oftentimes give us a clue that glutathione levels, right? So with antioxidant status, glutathione and methylation, that can give clues into that. And now with a lot of the organic acids tests, they've actually added glutathione markers on there. They weren't there before, but they've added those in there. So you can sort of see between things like, a B6, a B12 marker, even B2 with NAC, with glutathione, you can really get a good picture into someone's methylation.
Oh, that sounds very useful. Okay, great. Also, what do you suggest for a child who's 7 years old with parasites and dysbiosis?
Yeah, it's a hard one. Kids is not my area of specialty. I will just say that, but they do tend to respond really, really well to herbs. So generally and homeopathics for that matter. So what I would suggest with children is if you actually go with tinctures will work better because around that age, they still can't swallow capsules. So it's a little bit hard. So with tinctures as well, the good thing is you can actually titrate the dosage. So you can start off really, really slow, and then you can kind of work your way up. There are kits and formulas out there. The kid side of things is not my specialty. You do have to sort of, work the dosage down based on body weight. So it's probably the best I could offer you. Okay.
Great, thank you. A comment here, so much great information and way too much to remember. I need all the help I can get for clinical practice. In the course, I might say that Brett really stresses that you just need to go over and over things and just start practicing. You can't know it all at once.
No way. Yeah. Yeah.
Yeah.
I mean, practice, they call it practice for a reason, right? So, this is why I give people lifetime access to the content, because I want you to come back and I want you to review it. And the more that you review it and put it into practice, you start to see that there's a lot of common threads. Like the subtitle of it is, without reinventing the wheel. So the whole point is that you're not reinventing the wheel for every single client, and you'll start to see a lot of similar treatment approaches and patterns once you start getting into it.
Yeah, excellent. Okay. Lucy wants to know, when someone is dealing with die-off, what does that look like?
So die-off, usually, I mean, it all depends how hard you go. So typically someone is going to be experiencing nausea, vomiting, their gas and bloating will get worse. Depending on what you're dealing with, like if you're dealing with SIBO, for example, sometimes the symptoms can really pull a 180. So you could actually have someone who is suffering from, let's say, diarrhea. And if you go in there guns blazing, what will then happen is they can actually switch over and start to become more constipated. But generally what we see, and skin reactions as well, is quite common. A lot of people will report headaches, brain fog, these types of things getting worse. But here's the thing. If you're experiencing, or your client is experiencing something like that, usually that is going to be transitory. So what that means is a true detox reaction doesn't last for a very long time. So it's not like you're going to be experiencing die-off for 3 or 4 weeks. Usually what happens is it flares up in the beginning, and it can take anywhere from 3 to 5 days to settle down, even if you do nothing. Okay. Now, if you have very, very sensitive people, that die-off can actually be catastrophic for them. It can really throw a wrench in the works. So part of what I teach and what I practice is in those individuals, I like to put some checks and balances in place to minimize die-off. Also, what I do is I actually prepare them. So that's part of what I teach, is preparing for detoxification, so that you actually take a month, sometimes even 2 months, to work into the antimicrobials. You don't just go in there and start with that.
So can you clarify then, do you actually have to have die-off symptoms to know that the protocols are working?
No, you don't.
You can go slower.
Oh yeah, for sure. How do you know the protocol's working? The symptoms start improving.
Okay.
Is really it. Yeah.
Yeah. All right. Thank you. Shreya would like to know, could you go over why a probiotic may not help someone with SIBO or make things worse?
Yeah, it's very easy to explain. I mean, small intestinal bacterial overgrowth basically means I have too much bacteria. So if you drop more bacteria onto that situation and that picture, you're now adding fuel to the fire, is really what it is. So what you'll find is if there's lots of bacteria, you work with antimicrobials and you bring the levels down, and then you start reintroducing the probiotics, you'll find that the person's not going to react negatively to them. Now, there's another piece which is not microbe related per se, in that a lot of probiotics are histamine producers. And so because they're histamine producers, what you will find is you might not even have SIBO, but you'll find that your histamine levels are sky high. And so probiotics will aggravate that whole situation as well.
Thank you. All right, here we go. I sleep with a dog and most likely will need a parasite cleanse. Should I kick my dog off the bed? And I would like to add, what about cats?
So, I mean, people like Hulda Clark, right? Bless her. I mean, she's now she's since passed, but she was known as the parasite lady, like written books on the subject. And she was so hardcore. I mean, she would just tell you, get rid of your pets. I mean, this is how crazy she was, right? Yeah, very good, very smart, but that was her solution. So I would say, if you're around animals, I definitely wouldn't let animals like lick you and kiss you in the face like a lot of people do. But it wouldn't be a bad idea to do regular parasite cleansing. Let's put it that way. Okay. If they're simply sleeping next to you on the bed, how likely is it that the parasite's going to jump across the room and go into your body? probably less likely. But I think that, just the mere fact that you are living with animals, that you have a higher likelihood of acquiring parasites. Let's put it that way.
Okay, great. Well
Yeah.
explained. Thank you. What is the most common gut issue you see? Heather wants to know.
By quite a long stretch is IBS. So IBS is even if you get into the literature, it's the most common functional GI disorder out there. And of course, once you peel back the layers of IBS, you'll see that IBS is sort of the umbrella term, but underneath that, you've got the whole diet and FODMAP side of things. You've got the SIBO picture. You've got the adrenal and stress picture. So that's what makes it quite complicated to work with. So it's not just, go on a low FODMAP diet and manage your stress. If only it was that easy. Okay. But I see a lot of, again, I look at candida and dysbiosis and that those are really symptoms of a bigger picture. But I see that a lot as well,
Okay, great. Thank you. Here's a question. Are there particular microbes that can cause nasal constriction or congestion? And do they usually originate from the gut?
Yes and yes. So when you get into the literature on that, what you'll find is that's more related to fungal issues. So some studies have actually shown as high as 96% of participants suffering from chronic sinusitis have tested positive for fungus in the gut. Okay, so yeah. So for me, anyone with sinusitis, like I don't even need to test anything in the respiratory tract or sinuses. I just go straight onto the gut microbiome. And like 9 times out of 10, if you start working down the candida pathway, you're going to start to see some improvements with that. Now, of course, are there also airborne inhalant allergies and stuff like that? Absolutely. That's also quite possible.
Okay, so there's a few questions coming up about the program.
Yeah.
I'm going to, let's see, do you offer other courses than Holistic Health Masterclass?
I do. I have a number of them. So the Hormone Harmony, which is, that's what I spent my summer doing. It was finally, after wanting to do it for so long, I said, this is the summer. And I just stuck my head down and did it, which is why I haven't released a podcast for about 6 months, because I've built out a super robust hormone masterclass. The adrenal masterclass is kind of included in that, although it is available as a standalone. But the 2 live programs that I do are really the GI masterclass and then the Hormone Harmony now as well. I have a workshop coming up, which is more on the business side of things. And I'm launching a business, which was supposed to happen in May, but for many different circumstances didn't. That's coming up this month, actually probably beginning of November, Practice Online. And that's really, Practice Online is really an accelerator program. It's not as much to do with the health side of things, but it's more to do with the technology, the business and marketing, the community aspects, and that sort of thing, together with my partner, who's a very successful clinic owner and entrepreneur.
Okay, thank you, Brett. Love how you think in such an innovative way. Very beneficial to the industry. Okay, someone here has been out of the field for some time. Would you recommend any particular courses to take before taking yours and learning a little bit with better understanding?
Well, I think it's, it all depends so if you've been out of the field for a while, my first thing would be, are you ready to take on clients? So there's that. If you want, you can go, I'm just trying to think. I've got to post it. It's coming up. It's been a crazy busy time lately, but we have October 16th to 18th is the Unstoppable Practitioner Workshop. And that has a lot more to do with things like identifying your ideal clients, how to create your offers, your services, that sort of thing. What is your business vision, your mission, that sort of thing. So that's a robust 3 days of training and coaching. So something like that, I would say, if you're not set up to take in clients yet, really work on getting yourself set up so that you can actually process them. And then I would say it really depends on what areas you want to focus on. So like gut health is, I feel gut health is foundational. But if that's not your area of focus and you want to focus on something else, then I don't know what to tell you, I just find that for me, you know, a lot of the areas that I'm in now that I sort of like specialize in, I didn't really choose to specialize in them. It's just over many, many years, you start to see like people come in with skin issues, and it's like, well, I tried treating the skin issues. I tried doing the ointments, the lotions, all the crazy stuff. And it's like, once I started realizing you work from the inside out, and I just kept on doing that over and over and over again, that's how I've gotten really, really good results with all the hormone stuff, with all of the autoimmune issues, the skin issues, and so forth.
Yeah, okay, makes total sense. Are there any specific supplement combos or complexes available that break down biofilms as opposed to trial and error separating, I think, with separate botanicals?
Yeah, so there are some. I mean, one that's sort of really got the most robust literature behind it is something called biocidin or biocidin. It's a little tricky to get hold of, just because, yeah, just because it's a US company. But there are other products that are similar to biocidin. So let's just put it that way, right? So you could look into that. There's no shortage of proteolytic enzymes. One in particular is called Interphase by Claire Labs. So Interphase together with biocidin, it's a pretty deadly combo. Go slow.
Go slow.
Go slow. Yes, go slow. Yeah. Yeah.
Okay. Would you recommend healing leaky gut before addressing gut dysbiosis?
Well, it's a bit of a chicken and egg situation because, you know, what's causing the leaky gut? So what you can do is, this is where, and again, it's a very difficult question to answer because I would need to know a bit more about that person. But short answer is this: is you can put some stop gaps in there to sort of slowly start working on the leaky gut and at least provide some support. But when you get into things like immunoglobulins, for example, colostrum, your NAG, your L-glutamine, these types of things, what you will find is not so much the NAG and the glutamine, but the immunoglobulins particularly, they actually have a number of different functions. So in addition to sort of like strengthening gut barrier, they also work as a binder. They also work to support and strengthen the immune system and so on. So once I'm a big believer and a practitioner of minimalist supplementation, as well as lab testing. And so I find that the protocols, even for heavy duty conditions that are very, very complex, I can't remember the last time I went more than 8 supplements. That for me is a lot. So I find that when you start looking at things, and I would encourage everyone to just, when you think of supplements, don't just think of, I'm using this thing for this one thing over here. Think of, what are the secondary, tertiary, and beyond benefits or functions of that supplement? And you will cover so much ground. Like when you've got 4 or 5 products that are doing 3 or 4 different functions each, that makes a protocol that's very easy for your clients to follow, but it's going to really move the needle forward in a month or 2 if you stick them on that, especially with the diet.
Right. Okay. Do you have any recommendations for someone who has intestinal metaplasia? Any supplements?
That I do not off the top of my head. I'm sorry. Yeah, that's a bit left field.
Okay. Regarding inflammatory bowel disease, particularly severe, maybe ulcerative colitis,
Mm-hmm.
are medical doctors testing for infections these days?
Nope.
Okay. So that's a missing piece of the puzzle.
Yeah, so I mean, what I've seen anyway, because obviously I'm not communicating so much with doctors, but I see the tests coming in, and I'll say that the majority, if they have done any stool testing, it's usually at the maximum, it's looking for parasites, and it's usually 2 or 3 tops. So, the crazy thing is I've sent so many stool tests results back with my clients, and I sent them back to the doctor or back to the gastro. And I said, go and show your doctor this test and say, because I've softened up a little bit. So sometimes I will actually recommend, not that I can prescribe them myself, but I will actually recommend that people get on antibiotics. Okay, so there's some instances where you've tried the herbals, you've tried the diet, and unfortunately, heavy duty antibiotics is the way to go for that person. But because I can't prescribe them, I say, listen, take the test and go and speak to your doctor. And these are the types of antibiotics that have been shown to work the best for what you're dealing with. And I will say 95% of the time, the doctors come back with, we don't even know what this test is. However, if you go to the US, what you find now is that functional medicine and integrative medicine is quickly becoming the default mode of care because the population is seeking that out. And so now, providers there are far more in tune with what's happening with functional lab tests, whereas in Canada, unfortunately, doctors are just completely unaware of pretty well all of the tests that I've just discussed tonight.
Okay, well, there's a market for us there, I guess.
Big,
Right?
oh, big time.
Okay,
Big time, yeah.
And super complicated training required. Okay, everyone, I think we're nearing the end. If you have any more questions, please put them up. Brett, I have one here. What about people who can't eat garlic and onions? It seems to be very common. It's related to SIBO.
It is related to SIBO. Just again to sort of zoom out a little bit, I would not I never with anything, right? If they're just checking one or two boxes, I would be reluctant to just say, oh my gosh, for sure you have SIBO. We actually have questionnaires and things that you can ask them first, some of which I shared tonight. So once you start asking more questions, and I do this with everything, right? Whether it's hypoglycemia, adrenal issues, whatever it is, it's like, oh, okay, I think you might have SIBO. Do you also react negatively to this? And they start going, yes, yes, yes. And so what I'll do is I'll say, here's a list of high FODMAP foods, right? And take a look at what you're eating on your food journal. What do you notice? Oh my gosh, all of these healthy foods that I'm eating, they're all high FODMAP. And I'm like, okay, so maybe that's the problem. Let's stick you on a low FODMAP diet, see what happens. And lo and behold, in 3 or 4 days, I go, oh my gosh, I'm like 80% improved. Right. So that's kind of the way that I approach things.
Okay, thank you. I did find one other one here related to the topic in the chat. Can your body get addicted to taking HCl or digestive enzymes?
Well, it's not so much. So I guess a better word is dependent, right? This is an ongoing debate that's been going on for a really long time. I would say with HCl, probably not, because the amount that you would have to take would be pretty astronomical. However, with enzymes, there's a distinction between plant-based enzymes and pancreatic enzymes. So plant-based enzymes, we don't produce those. They're only found in our food. With pancreatic enzymes, I don't know that anyone's actually really figured it out because it's really theoretical. And so the theoretical side of things says that if I put pancreatic enzymes in because I naturally produce them, you're telling your body to stop making them. Okay. In reality, enzyme levels naturally decline with age. So I would be reluctant to sort of say maybe someone in their early 20s, get on high doses of pancreatic enzymes forever. However, if someone was, 60, 70 and had digestive issues, I don't really see the harm in them taking it long term because their levels are naturally declining anyway. Okay. But in most instances, what I prefer to do anyway is I prefer to restore function if possible. So actually, getting the body, whether it's related to nutrient deficiencies or whether it's using digestive bitters or what have you, is actually getting the body to produce more enzymes and secrete more enzymes and bile and that sort of stuff.
Okay, that's great. So much really to filter through. Everyone, I'm sorry if I've missed a question of yours. There are a few in there that weren't related to the topic, so I've let those ones go. And I want to thank you all for attending. If you're interested in the gut health practitioner masterclass, go to the IHN website. It's under the continuing education tab there. And Brett, thank you so much for sharing your time and wisdom. And you, right before the Q&A, you said that I said it's an exhaustive course. I said extensive. It's not exhaustive. It's actually invigorating, but there is so much information you present. It's well worth it. So
it's a library. It's a repository of good information that you can keep coming back to.
Right.
That's how I see it anyway. Yeah.
Okay, fantastic. So that concludes everything today, everybody. Wishing you a good day, good night, wherever you are. And this recording will be sent out. If you get one of the newsletters, IHN Weekly Digest or the IHN This Week, they get sent on those, and it will be posted on the IHN YouTube site. So thanks very much, everybody.
Great. Thanks, everyone. Have a good night.